We all know that medical scans like MRIs and CTs are just incredible pieces of technology. But what we don't always talk about is the part that really makes them work, the skilled, empathetic human care that surrounds the machine. So in this explainer, we're going to focus on that human touch and how it's all designed to support you, the patient. Have you ever had that feeling, maybe the night before a scan, where you're just lying in bed, your mind racing with questions, maybe feeling a little bit of dread? If you have, you should know that's completely normal. In fact, it's a super common feeling. You are definitely not alone in feeling that way. So that's what we're going to do right now. We're going to pull back the curtain on these procedures and really explore how medical teams are trained to anticipate your concerns and focus on one single goal, putting your comfort and your understanding first. All right, let's start with the big one, what for many people is the most intimidating scan out there, the MRI. It's an amazing diagnostic tool, no doubt about it, but it comes with a couple of pretty well-known challenges. You know, the experience of an MRI can feel like a total contradiction. On one hand, you've got these loud, banging noises and a very, very enclosed space that can absolutely trigger claustrophobia. But on the flip side, you have a dedicated team whose entire job is to ease those feelings through constant communication and a real commitment to your comfort. They are right there with you every single step of the way. So how do they actually do it? Well, it's all very practical. You'll always get ear protection to help dull those loud noises, and the whole time, a technologist is in constant contact with you, letting you know what's happening, how much longer a sequence will take. And listen, if anxiety is a real concern, sedation is always an option to help you relax. And that stillness, it's absolutely vital. Any movement can create blurry spots on the images that might hide what the doctors need to see. Okay, next up, CT scans. The principle of patient care is exactly the same, but the focus of anxiety tends to shift a little. Here, it's usually less about the machine itself and more about something called intravenous contrast. The process is actually really straightforward, and it's all centered on your safety. First, they're going to explain everything to you. Then, the contrast agent, which just helps certain tissues show up more clearly, is given through an IV. But here's the most important part. From that moment on, you are being watched so closely for any sign of an allergic reaction. It's rare, for sure, but it's something the team is 100% prepared to handle immediately. It's all about safety and preparation. Now let's talk about two procedures where that human touch is, well, literally front and center: ultrasounds and mammograms. In these scans, communication is everything. So during an ultrasound, the sonographer has to apply some pressure with the probe to get a clear image, and yeah, sometimes that can be uncomfortable. The solution is so simple, but it's incredibly powerful: open dialogue. Your sonographer wants you to give them feedback. They are trained to adjust that pressure to find the perfect sweet spot between getting a high-quality image and making sure you're comfortable. And it's a similar story with mammography. I think we all know that the positioning can be uncomfortable, but it's a necessary part of getting a really clear diagnostic image. The thing to remember is that the technologist is a highly trained professional. Their job isn't just to run the machine, it's to guide you into the right position as gently and as efficiently as they possibly can. Now, one of the key things that comes out of a mammogram is your breast density. This has nothing to do with size or feel. It's all about the mix of tissues inside. See, on a mammogram, dense tissue shows up as white, and unfortunately, so do many potential tumors. This means dense tissue can sometimes act like camouflage, making it harder to spot issues with mammography alone. And because of that, there's been a major step forward in patient care. New laws now require imaging centers to tell you if you have dense breasts. Now, this isn't meant to cause alarm, it's all about empowerment. It opens up a really important conversation between you and your doctor about whether additional screening, like an ultrasound, might be a good idea for you. So, as we start to bring all of this together, you can see a really powerful theme starting to emerge across all these different technologies, can't you? The common thread is you. It's always you. Whether you're getting an MRI, a CT scan, or even other things like bone densitometry to check your bone health, or interventional radiology for minimally invasive treatments, the core principles are identical. Educating you is the priority, and your comfort is absolutely central to getting a good result. That's the universal standard of care. You know, at the end of the day, it really boils down to this. The most advanced, expensive machine in the world is still just a tool. The real focus, the real value, comes from the skilled, empathetic care that the people operating that technology provide. That's what truly makes all the difference. And that leaves us with one final thought. Now that you have this understanding, what's one question you'll feel more confident asking at your next appointment? Whether it's about managing noise, understanding a procedure, or just saying, hey, I'm a little nervous, remember that your voice isn't just a part of your care, it's the most important part.